Hi, Abby. Thank you for coming today. I'm Dr. Depaz. I am a pre-licensed counselor. That means that I will be supervised for the type of work that I am doing. My direct supervisor is Dr. Angela Johnson. She is a licensed psychologist in the state of Texas, and I also have a second supervisor as well, Dr. Kent, who is also licensed in Texas. Tell me, how was your ride over here?
It was good. It was raining a lot, so that makes me a little nervous in the rain, but I finally got there.
That's great to hear. I'm really glad that you came in today for our visit. So, before we begin, I do want to go over some of your patient rights. Number one, you are protected both by the federal and the state laws. One of your patient's rights is that I am not allowed to share any information that could identify you and or use any information that you have or share. Okay, so that means it is strictly confidential. With that, I also want to disclose that there is a confidentiality portion, and I want to make you aware that for sure I would have to break that confidentiality if you tell me anything that has to do with you wanting to commit suicide, wanting to hurt yourself, or wanting to hurt somebody else. Okay. So in this case, I would have to break that confidentiality. Or if you were to tell me anything about maybe hurting an elderly person, or if there's a child abuse or anything like that matter, again, I would have to break that confidentiality. Are you understanding this? Do you have any questions?
Yes, I understand. I don't have any questions.
Okay. Do you consent to the services that I will be providing today?
Yes.
Okay. So the next thing I want to share also is regarding your initial assessment portion. That is the form that you filled out at intake, and that is also the objective that we have today. So the objective number one is to get to know you, right? I want to be able to know a little bit about your family history, your background, things that may be of some issue that we know you may be having, so possibly some stuff related to work or school, but basically I want to get to know you better. And the better that we get to know each other, the easier it's going to be so that I can provide treatment for you, okay? So you will find that in today's session, I am going to ask you a lot of questions that are similar to the intake form that you filled out before we started. It's basically a lot of information about the symptoms, your background, your strengths, your goals that you have here in therapy. So I don't want you to think that there is a right answer or a correct answer because there's not. The best answer that you can give me is always an honest answer. So as I mentioned, I can't share this information with anybody else. Do you have any questions at the moment?
No.
Okay. Then, as I said, it's really short questions. You don't have to elaborate in a lot of details. So just answer to the best of your knowledge. Okay. So let's begin. Let's go over your intake form. You filled that out about those concerns that you were having, and I skimmed through them. I looked at what you wrote, but I wanted to ask you basically and hear you say, uh, as much as you can share with me, what is the main concern that you are having? So we're going to start with that. I want you to tell me in one sentence what brings you here today.
My main concern is just that I can't seem to hold down a job, and I feel like with that, a lot of other things are wrapped into it. I can't hold down a job, not because I'm not a good employee. I believe I'm a great employee, but I just get bored after being there for a while. I don't know. I feel like I'm sometimes flicky. I'm not a flicky person, but because I tend to from job to job, I feel like my resume makes me look that way. But I just start to feel kind of anxious about that, and that other people won't want to hire me because my resume looks like I move a lot. I want to be work at a place where I feel comfortable, where I feel like I want to spend my time at work.
Okay. Very sorry to hear that you feel that way. It is really challenging to feel judged. I am happy that you're here for that, and I can help you with that if that's your goal in session. So, you not feeling that you're not holding a job down for a long period of time is a huge concern for you, correct? Can you tell me more? When did you first realize that you felt this way?
Well, I was working at CVS as a shopper and then as a cashier. I am very social and have great customer service. I am a quick and fast learner. I know that's why I got moved really quick to the register. I did that for about 8 weeks, and then I let my supervisor know that I wanted to be considered for promotion, and I applied, but nothing has happened. It's been over 3 months, and I haven't heard anything, and I'm feeling anxious, and I'm already thinking of applying to other different places. I just want to enjoy what I like doing, and mostly because I feel like God gave me a specific set of gifts, and I guess when I feel like I'm not utilizing those gifts, I start to feel, for lack of a better word, I start to feel something free inside of me. Move on, like they were saying.
Okay, so let me see if I've heard what you shared correctly. You mentioned that you're not comfortable at your jobs after a while. You do like to transition from jobs from one to another, but then you realize that that job doesn't really make you happy, but you are a fast learner, and that's why you've been promoted recently, yes? Okay, so tell me about those feelings. Explain to me a little bit more about how you feel.
Well, first I get really excited when I start a new job. I'm really pumped, I'm eager to learn, and can't wait to start. I love meeting people and making friends with my new coworkers and things like that. But then after a while, maybe 4 to 5 months, I start to feel really unhappy. I start to feel like, I'm bored and no certainty or point to going to work. I feel like there's nowhere for me to move up in the company. So then I start getting that feeling, like I explained. I just feel like I have to move on with my life. Like I have to make a change and find a new job.
So, when this happens, do you feel the positions that you have are not fit for you?
Yes, I feel like I need a change and something new.
You also mentioned that something about your resume looking flaky. Tell me a little bit more about that. Why do you feel your resume may not look well?
I think it's probably because I've had, 4 to 5 jobs in the past 2 years. I feel like, any hiring employer is going to look at that and assume, like, well, this person can't hold out a job, so why would waste your time with them, Because we don't want to hire someone to train them and then they leave us in 6 months. I feel like I'm being judged.
I hear what you're saying. I will say that it is common for a young person like yourself to seek different jobs and to get to know those jobs. If someone doesn't like that job, they're bound to try something new. And sometimes in the resume, employers do look at that. They may see that the person has tried different things or different approaches and practices, but they are bringing forward those different techniques and experiences in other areas. So, in a way, that could be a plus because that means that you've tried different positions, different jobs, and you have that experience in different areas. Let's talk a little bit about how you mentioned that spirituality part in your intake form. How has that helped you in situations that you feel you have a problem that you're facing or that you have?
I mean, prayer, I've always turned to prayer first, and that always makes me feel grounded. It makes me feel and reminds me that God does have a plan. I consider myself to be a very spiritual person, and I think along with that comes that desire I have in my heart. I feel and know I'm being called to serve God's people, and I know that whatever I do, I want to be serving it. And but two, I feel like I have that skill set's not being utilized. That's when I start to feel, I need to move up, doing what God is calling me to do.
Yes, that is very important. You do have a side of positive knowing that there's that calling out there for you, that you want to do certain things, certain jobs, and it's basically how you feel confident about yourself because you know. It's a good thing that you pray a lot. That helps you. That's a very good way of feeling support through God. Is there anything else or anybody else in your family or friends that you feel that you can reach out to and talk to when you're going through something like this?
I mean, my family and friends all support me very, very, very much. They're all very proud of me. My family does love me and they support me. And I have a difficult relationship with my dad, but that's kind of another issue itself. But for the most part, I'm very supportive. I know that I'm very loved and appreciated and things like that.
Well, that's unfortunate to hear about the relationship you have with your dad. We can discuss that at a later time when you're ready. But it is good to hear that you share that support with others in your immediate family as well. Remember, they can be your support, and it's comfortable to reach out to them if you feel that way as well. Okay, so now I want to kind of go over some of your medical history again from the intake form. I do have some questions about that, okay? Let's go over some of your social history. I do have a few questions again from the intake form. Okay. If I Let me pause. I were to ask you what your goal for our therapy session is, or what you wish to gain from everything, what would it be?
My goal is that I just happy with my job, myself, and maybe life.
Okay. In your words, try to explain to me as best as you can what it means to be happy for you, whether you are at work or not.
Well, that I would say that I look forward to getting ready to go to work, being with my coworkers, feeling comfortable. It just feels like I never know what I'm going to get, and so I'm always kind of on edge and I worry a lot.
Share with me what you worry about, those insecurities that you're having when you get to work.
Well, I sometimes feel inadequate because, like I said, I feel like I'm sort of flaky. I think that everyone judges me. I worry about how long I must be at work for, and that the day will drag into for my shift. I am happy when I get to help others at work, like the customers, or when I myself train my new coworkers. But mostly I'm happy when it's paid. I get paid every Thursday, and I look forward to checking online and seeing my check deposited to my account because that means on my day off, which is Saturday, I can go shopping.
Well, that sounds terrific. I'm glad that you shared that the payday makes you happy and it's something that you look forward to every week at work. I feel that you shared a lot of valuable information for today. So now I want to give you a chance to talk or ask any questions that you may have for me. For example, if there's anything else you'd like to know a little bit more about. No. Okay. All right. I also just want to mention that at the time, if there is anything whatsoever that comes up from now or until our next session, please let me know and we can try to discuss it and add it to our agenda. What I want to do now is I want to share a technique and talk a little bit about a goal that will help you cope with your feelings when you are getting anxious or edgy when you're at work. Okay, so let's take a little moment. I'm going to show you kind of the steps and walk you through on the technique. And the technique is called reversed breathing. This is where you're going to consciously control your breath and those abdominal movements in a way that's opposite of typical breathing. So let's think about this for a little bit, okay? When we're breathing, we inhale through our nose, exhale through our mouth. So this technique is the opposite of that, and it's going to improve your energy levels to promote that sense of calm and well-being. Okay, so we're going to practice it together. So first, make sure we're sitting comfortable. Uncross your legs, and the next thing I want you to do is take one of your hands and you're going to place it on your lower abdomen. Okay, ready? All right, so now we're going to inhale deeply through your mouth, drawing in that air into your abdomen towards your spine. We're going to hold for a count of 5 seconds and then we're going to exhale through our nose. Okay, I'll model the first one, we'll do it together, and then we're going to repeat this process 3 to 4 times. Okay, so let's do it together. Ready? Inhale deeply. Exhale through your nose. Try it again. Ready? Inhale through your mouth. Exhale through your nose. Ready? Let's do it again. Ready? Inhale through your mouth. Exhale. Great. So now you have this tool to help reduce that anxiety that you're experiencing, whether you're at work or other situations like that. Okay. So that's one technique we've talked about. The next task that I want to talk about is a little homework that I'm going to give you where you are going to be tracking and logging the number of times a day that you start to have these feelings and thoughts at work. So, for instance, let's say tomorrow it's 2:15, you're at the register, and then all of a sudden you get that sense of feeling of sadness or, doubt. I want you to stop what you're doing, step aside, do this treatment, this treatment of inhaling through your mouth and exhaling through your nose, but also write it down, whether on your phone or on a little journal. I want you to jot down how you feel afterwards. If you're at ease, if it's the worst or the same, however you want to track it, but I do want you to keep logging that, okay? Because what we're going to go over the following week is see if there's a pattern of when this is occurring and exactly what are you doing at the moment that's kind of triggering that reaction for you to start having those doubts and those concerns or thoughts that you're having, okay? So how does this sound? Does this sound like something you can do?
Yes.
Okay, great. That's good to hear. So, what I would like to do next is kind of get you scheduled in for the next session. In our next session, we're going to go over together again those feelings that you're going to be tracking for the week. You're writing down, you're jotting down the information that I asked you to track of. But I am truly glad that you came today to visit. Like I said earlier when we started, this is the hardest step. And look at you now. We can check that off because we're done. So thank you very much for allowing me this opportunity to get to know you better and you answering those questions for me. That was very, very important. Do you have anything else that you would like to share with me for our next session?
Yes. I really like to find a job where I can really utilize all of my skills. I want to find a job that feels like my environment and serve the way I feel while I'm being
Absolutely. Great. I like hearing that. How about we create something like a plan in our next session where we can look at and discuss those thoughts that you're having, maybe about your resume. How you mentioned that they make you sound flaky and that you think other people might consider you not being a good candidate for a position, or I'm sorry, for a position because you don't feel good about your resume. So be thinking about what kind of goal we can create that'll help you towards not having those negative thoughts in your resume. So before we end our session, I would like to close with a prayer if you're comfortable with that. Will you allow me to do that?
yes.
Sure. All right, great. Absolutely. So what I would like for us to do now is just bow your head. You can close your eyes and I will lead the prayer. Okay. All right. Dear Lord Jesus, thank you so much today for gathering with us today as we embark on this journey.